Treatment to correct upper eyelid hollowness and excess skin. Hi, I'm a female in my late 30s who has excess skin and hollowness in my upper eyelids. I have had fillers put in my left upper eyelid, but this has only made the excess skin more prominent. Please, can you recommend a course of action to obtain some sort of symmetry, please?
Thank you for your question. The photo you submitted clearly demonstrates what your concern is, and you're stating that you have these excess folds over your skin, that you've had filler performed to help you address these folds, and you still feel like and you felt that the folds got worse. So, what is the next appropriate issue, or solution, I should say? Well, I'm a cosmetic oculofacial plastic surgeon. I specialize in eyelid surgery, so I can certainly give you my assessment and how we've dealt with issues similar to yours in the past. First, we have to learn the anatomy. You know, with most issues of cosmetic nature, it always comes back to proper anatomy. And so when I look at your photos, I notice that your eyes are relatively prominent. What you describe as hollowness is actually just the normal position of your eyeball relative to the orbit or the eye socket. And clearly there's a difference. The right eye has a certain amount of folds in the skin, and the left eye looks like it has a couple of folds and then one large overlapping fold. So the question that needs to be answered is, what is your ideal final goal? In our practice, we have certainly had successful results in helping people deal with their hollowness over their eyes by adding volume to soften that transition between the bone of the orbit or the socket and the position of the upper eyelid. Now, this is sometimes done in patients who of Asian origin who have had a lot of fat removed and want to try to soften that appearance. But I always am hesitant when people have this natural congenital, you're born with that particular anatomy. It's challenging to put enough filler in a way that'll make a significant enough difference. And I suspect what got you frustrated previously was that the volume of filler was past the amount that would be effective. So, in fact, that's unfortunately a limitation. Fillers are soft, and they can only maintain a certain amount of cohesive shape up to a certain point in various tissue spaces before they start getting soft and pillowy. And that's why a lot of people who get fillers done in excess look abnormal, because they just start to lose their shape. So I would suggest considering an option such as an upper eyelid blepharoplasty. The reason why you have these folds is due to the limitations of the way the muscle called the levator muscle interdigitates or connects with the skin. The levator muscle creates a crease in the upper eyelid skin, and the muscle that lifts your eyelid, I should have explained that. And so the crease, those fibers have different insertions in both eyes. So sometimes with patients like yourself, we'll address any excess skin and try to anchor the skin and try to get the skin to fold in, and so that there aren't as many folds. It's tricky. It's not always feasible, because when you think about it, when you have to have enough skin to close your eyes properly, and if there is no excess skin, then you really don't have that many options. Sometimes again, I'm using the analogy of Asian eyelid surgery. We do a non-surgical or non-incisional crease formation by creating anchoring with the skin. But the difference is, with Asian eyelid surgery, you have this skin that overlaps that allows allows us to be able to camouflage or hide any work that's done in the crease. In your situation, that is probably not practical. So I think you should meet with qualified, experienced cosmetic surgeons who do a lot of eyelid surgery. And I think that it's important that you have people with a lot of experience, because as surgeons, I'm in practice for 20 years, there are many things I know today because I've tried different things along the way and learned from those experiences. So meet with cosmetic surgeons, learn about your options, learn and also determine what will ultimately make you happy. It may not be possible to achieve what you're looking to achieve, and so it may not be worthwhile for you to do anything at all, but at least learn by someone doing a proper physical examination. So I hope that was helpful. I wish you the best of luck, and thank you for your question.